Good afternoon, Santa Clarita. This is Tom Burton, the Orthopedic Program Manager with Providence Holy Cross Medical Center, bringing you the Providence Holy Cross Health Hour, coming live from the studios here in beautiful Santa Clarita. Got a stunner of a day. With the sun is out, spring is definitely sprung, and the drive up was extremely pleasant for those of you who are coming north on the 5. You're going to have a very easy drive. Coming to you from the station here at KHTS Radio, and extremely excited as we, as Holy Cross, we are continuously improving and continuing to grow. And though our association with Santa Clarita may seem that, well, they're in San Fernando Valley, why would they be out in Santa Clarita? That's we have been Santa Clarita adjacent forever, and we continue to deliver care and offer our employees, who are all residents here, it seems like, here in Santa Clarita. About 30% of our patients are coming from the Santa Clarita Valley, as well as about 30%, if not more, of our employees actually live in Santa Clarita. It just seems to be a natural progression that we would extend ourselves into the Santa Clarita Valley to be able to bring health care that Holy Cross has been delivering since the 60s out to the Santa Clarita area to make it more convenient, easier for you to be able to receive the care that we've been able to give and perform and be recognized nationally for. Well, we've been around since 1961. The sisters opened shop, so to speak. We've been able to grow through general need within the community, but also through the help of a couple of earthquakes, to a 377-bed hospital. And we're not for profit, which to those who will know, means that we have the requirement that we take care of everybody. And we are a very busy hospital and glad to do so. Most of our employees are also known as caregivers, whether it be a nurse, whether it be a physician, a physical therapist like myself, or even the people who are doing the environmental services and cleaning. We are all caregivers, and we are all small cogs to the ability to deliver care to our patients. So it makes it very, very exciting for all of us to be able to do the work that we do in Holy Cross, and the Providence Health System makes it very easy to allow us to do so. Now today, you know, it's a great time to have this conversation. I just had the opportunity to see one of my dear friends who is over from Australia and from the East Coast, and I've been really, really lucky to have him in my life. And his wife, about 3 or 4 years ago, died from breast cancer, from the complications, and she battled hard. Had difficulties along the way, and she was a very, very interesting person, as for those of us who grew up in the 80s and the 90s will recognize the group, the Divinals, and the lead singer, Chrissy Amphlett, was the lead singer, and she passed due to breast cancer back in 2013, and was my friend's wife. And the unfortunate part of that is that, or the fortunate part of that, is that her band's biggest hit was "I Touch Myself." And when Charlie and I were speaking last, he indicated that because of this hit that she brought to the 80s and 90s, and may have had maybe a different connotation back in the day, can't be any more fitting now based off of the battle that she's gone on, that she had to endure. And with that, Charlie and his people have put together a new organization that is based off of that song. "I Touch Myself" project came around a few years back and has been slowly growing in the Australia area where Chrissy was from. And Charlie had indicated he's very excited to think that maybe this will be coming to America coming up in the very near future. I do recommend, please do go to the website, itouchmyself.org, and take a look at all the information that is on there. The goal, of course, is early prevention and detection, and really goes into the first concept of just self-examination and being very body aware. One thing that was extremely well put in the song, and when put to a different reason, the song becomes more pertinent than ever. And being that Providence Holy Cross and Providence Health System, especially in the Valley with Providence Tarzana, we are so proud to know that we have a new association and a partnership with the City of Hope. And now the City of Hope, if I'm sure everybody is aware, if you haven't heard it on the radio, you've seen it on the TV, you've read it in the news, they do unbelievable work delivering care for countless thousands and thousands of people, and they've been located in the Duarte area. And with the amount of work that they've done, they've realized that we need to get out to the community because the community is having difficulty getting to us. We want to be able to extend that unbelievable care. And so the City of Hope has been able to branch out, almost like a pebble dropped into the water. You can just watch each ring as it goes. And they've slowly been growing in the Southern California area. And I cannot tell you how lucky we are that that City of Hope and Providence, who seem to share a similar mission, are now going to be able to deliver care conjointly, not only in the Valley, but most importantly here in Santa Clarita. And we're really lucky because we have a couple of extraordinary individuals here with us today. And I just want to have the opportunity, they're looking at me going, really? Yes, extraordinary. Let me introduce first, and then we'll kind of kick into some stuff, if we will. To my extreme right, for those of you watching on Facebook, we've got Tricia Eugenio. Now she is the nurse navigator for Providence Holy Cross, their cancer program here in Santa Clarita,
Correct.
In conjunction with the City of Hope.
Correct.
Perfect. I want to make sure I got that right. And then just closer to me is Dr. Dorothy Chu. And I'm just going to throw this out there because I was intrigued. I do a little bit of research. And I was intrigued with this. 2015, member of the leading physicians of the world. No small honor. Okay, so that's the world's not too small of a place, though, and luckily about 1 million miles away, we got missed by an asteroid today. So let's not worry about that. But specialist in breast cancer surgery,
Yes.
from my understanding, a UC Regent trained physician over at in San Diego, which is kind of cool. I'm a UCLA guy. The surgical internships, residencies over with UC San Diego, as well as doing your pediatric surgery fellowship up in Oregon.
I did that for about a year and realized that as much as I love children, I think my true passion lays in their mothers, so to speak, and the kids themselves.
That's great. And now, we'll just go ahead and just kind of kick in.
Sure.
Now with City of Hope and being a part now within the Providence family as well. I want to just say, let's start first with early detection, I guess is a great place to put it. As Chrissy and I know my friend Charlie would definitely want it to really, our best gains and our best cures, if you will come when we can start treating things earlier.
Oh, absolutely. We're still at a point right now where we don't know how to prevent every cancer, and breast is included. But we are much better at detecting it, especially at a very early stage. And frankly, these days, if we find a breast cancer in the early stages, the chance of survival and cure is tremendous. And the vast majority of women, if they're found early, will survive their cancer and go on to live the rest of their lives. It is unfortunately the few that don't get the early detection that we have a much harder time helping them fight that battle and win it. So really it's about early detection.
And that can start from something as simple as, and now I know we're talking about women primarily, but men with breast cancer, it's about 10%?
It's probably a little bit less than that, to be honest. We're probably looking more around 5% of the majority of cancers diagnosed here in the States. But it is a significant amount. And what you said, I wanted to pick up earlier on what you said earlier, which is body consciousness. I think that is something that we don't stress enough. And I don't mean body consciousness as in the not feeling good about your body. I mean being aware of your body and knowing what is normal. I think for yourself is so important because that's really where the early detection can oftentimes start, is being aware of changes that might be occurring and then alerting the right medical provider to be able to evaluate it further and perhaps catch something a lot earlier.
Perfect. And then, so not only visually being able to see, maybe we're looking for changes, things that don't seem, that were different now than they were not too long ago.
Absolutely.
Any other things that they could be looking for, right up front, just visually speaking?
Sure. I think there's been sort of recently some controversy about whether or not women should do self-exams. There was a time when we pushed it on everyone and everyone should examine their breast all the time. And now we're sort of pulling back a little bit from that as a recommendation. And I think the reason is because we haven't done a very good, we meaning the medical professionals, we haven't done a good enough job, I think, of teaching women and men what does that really mean to do a self-exam. The key is not to be looking for something. I always tell patients that because that's not your job. that's my job, so to speak, to actually find the problem. But what anybody can do for themselves is knowing what their body looks like and feels like as a normal condition for themselves. And then if something changes from that normal, whatever that change might be, that's worthy of investigation. But if you don't know what normal is, then it becomes very difficult to know, has this changed? Has something changed? Not all change is bad, but it's worthy of concern. And so what I would counsel everyone to do is once a month for breast exam. You don't have to do it every day. In fact, I would discourage you from doing it every day because subtle changes might happen, and if you do it too often, you might miss those. So once a month is plenty to take the time, and it shouldn't take more than a few minutes. Certainly, looking at yourself in the mirror, I think, is a very good start because there are parts that you won't be able to see just by looking down. So it's important to see the entirety of the body and be able to then register what does it look like? What do your breasts look like? And you're just looking for skin color, that it's uniform. You're looking for size differences. It's very common to have size differences. So again, if you know that that's true for yourself, that won't be an issue. And then any other, texture changes where the skin, instead of being smooth, maybe looks more wrinkled, looks like something's pulling it in. So you get a little dimple where there hasn't been before. Those would be kind of visual cues that maybe something is happening that we need to investigate. Discharge would be another one that you might see visually. And then when we talk about the physical exam, learning to feel the texture of the breast is important because, especially for women, the majority of breasts are going to feel lumpy, bumpy.
Right.
And it's normal to be lumpy, bumpy. So, to be alarmed every time you feel a lump could make you crazy.
Right.
And so knowing what your lumpiness is I think is a good place to start, and knowing what your breasts feel like under normal circumstances, and the vast majority of breasts are normal, then I think it's good to have that knowledge. That way, when that change happens, if it happens, something feels a little firmer. If you feel something that feels like a little ball rolling around or a little rock, something hard that shouldn't be there or hadn't been there before, those would be things to get checked out. Don't panic. Vast majority are still not going to be cancer, but still those would be worthy of bringing to the attention. And the sooner you do that, the more likely it is that we can fix the problem.
Right. And it's you mentioned to know what normal is, and so it would almost be beneficial to be with your medical practitioner and let them maybe go through an examination and make a determination that, yes, indeed, this I would think would be a normal exam. And then you can feel to see what they think is a normal exam and then try to remember that.
Absolutely. I absolutely think that this should be coordinated with a care provider, whether it's a family doctor or a gynecologist, whoever would be able to kind of go through that with you. I think it's always the best place to start is with a physician exam. That way you can express concerns if you're not sure about something to kind of clarify what may be normal. But even if you don't have that, and some people may have an access problem, being able to find the right doctor to do that with, even just being able to just start doing the exam even on your own, I think is of value, because then if you do it consistently from month to month, you'll be able to compare what this month felt like to next month, because really the way to establish normal is to know consistent. Something that's the same will be, quote, normal. It's something that changes is where we have to maybe look at it a little bit differently. The physician exam is just as important. The difference is when I do a physician exam, so to speak, or physical exam from my perspective, is now I am looking for very specific changes. And that's my job, to look for those specific changes. That's not something that you should be doing on your own. The idea, like I said, is if you get an idea of what's normal for you, then anything that changes from that, don't panic, but anything that changes should be addressed. So it's really the change that's important from a self-exam perspective, not necessarily a specific factor.
Correct.
That's what the physician exam, I think, is about. So it absolutely, I think the two should be in conjunction. And one without the other, I think you're missing a very crucial part.
Right. Okay, that's perfect. And so really, it's really acknowledging any difference or a delta, if you would, that will have from week to week, month to month, or so forth. And we in physical therapy
Absolutely.
will do that oftentimes. Is that sometimes you have to feel an awful lot of normal before you can actually sense what's abnormal. And then if worse comes to worse, just compare the two sides.
Absolutely.
Which a lot of times seems to help too. Now, we talk about doing self-assessment. Is there an age in which someone should begin doing self-assessment?
I think a woman should start doing them as soon as she has breasts,
Okay.
to be honest. Now, having said that, psychologically, most teenagers are probably not ready to think about this as an issue, and I would say that's fine. In your sort of teenage years, the breasts are changing very quickly. It's a little harder to monitor for differences because they will feel different. I think realistically, by the time a woman enters into her 20s, where her development now has matured and it stabilizes, then I think it's a good time to start, because lumps actually start happening when you're in your 20s and 30s. And most of the time, they're absolutely benign. But they're the ones that tend to kind of freak people out because they'll randomly feel a lump and become very frightened by that when it's oftentimes very, very normal. So I would say, certainly, I would encourage women anyway to start in their 20s. But at the very least, if the primary concern is cancer, the vast majority of cancers will develop after age 50. So certainly, it's unlikely you will develop a cancer in your 20s. Even less, and just as unlikely in your 30s, although it does happen. And 40s is probably where I would say certainly start thinking about that, maybe start to get into the habit. But I would certainly encourage any woman after the age of 50 to really try to start, if not already, to do regular self-exams monthly to really keep up with that.
Perfect. And then they, just to kind of continue on in this idea, Tricia, I know last month there was some discussion regarding genetic testing, and that Providence Holy Cross is now offering the genetic testing.
Correct.
And is this something that would be beneficial with breast cancer? We have a couple minutes, at least we can kind of and we can come back after the break.
Yes, Providence Holy Cross, as you know, it's a magnet institution. They are they are committed in providing access to care, especially for the Santa Clarita community. And the newest addition to their cancer program is genetic counseling. So I am the oncology outpatient nurse navigator, and I am the go-to person for a cancer patient. And if they have any questions about their treatment, if they have any barriers to care that they are experiencing, they can call me. And one of them usually is genetic testing or genetic counseling. We do have the capability now to see cancer patients, their families, or caregivers to go for genetic counseling every Wednesday at Providence Holy Cross in Mission Hills. So I will be the resource person for that, or they can contact Monica Helm at Providence Holy Cross if they want to contact her directly. But I'm here as a caregiver for the Santa Clarita community, working with the City of Hope office and providers to be that person that they can go to for information.
Perfect. Well, I think we're going to go ahead and take a break at this really quickly, and then we're going to come back and we'll talk a little bit about the genetic testing, and then maybe get into mammography a bit,
Sure.
and also just surgical approach and what we would see as far as interventions. So you're with us here on the Providence Holy Cross Health Hour. We're being joined today by Tricia Eugenio, as well as Dr. Dorotha Chu from Providence Holy Cross and the City of Hope. And you're listening here on KHTS Radio. We'll be right back.